Established on May 22, 1939, after a special decree from Her Imperial Majesty the Empress, the Japan Anti-Tuberculosis Association, Jata, is a public corporation whose aim is to promote public concern on the prevention of tuberculosis and other related diseases. Jata is providing technical assistance and program support to TB control in several countries including Zambia, Cambodia, Nepal, the Philippines, and Indonesia. In Zambia, Jata was registered as an NGO in 2008 as one of the overseas branches of the Jata Japan. Jata Zambia aims to mitigate global and individual burden of tuberculosis and HIV-related diseases. The Japanese origin NGO has been implementing projects and providing technical assistance to the government of Zambia through its current team of 7 Zambian staff and 2 Japanese. In the last 10 years, Jata has had 3 projects, with the first one conducted in Baulene of Lusaka district from 2008 to 2012 for TB community dots with people-centered approach in Zambia. Funded by JICA from 2012 to 2015, the project extended to Chilenje and Charleston. Here, Jata conducted community mobilization for TB diagnosis and treatment supporters project. Tuberculosis in Zambia is a major public health problem with a prevalence estimated at 376 per 100,000 population according to the Ministry of Health. Ministry of Health Permanent Secretary, Health Services, Dr. Jabin Mulwanda, says that tuberculosis in Zambia alone claims over 17,000 lives every year.
TB is responsible for 17,000 deaths per year. What is interesting is that only 2,000 of these 17,000 deaths occur in health facilities. What this tells you is that 15,000 cases die before they've had a chance to access health services. Clearly, there's something that is working well. They've also been involved in supporting our facilities with equipment such as digital x-rays. And I see that their stay in Chongwe, their mandate in Chongwe is coming to an end. But that is not the end of the success or the good things that have come out of the work of Jata in Chongwe. The work of Jata in Chongwe has to a great extent informed our planning updates for districts and facilities. So the good things that have been happening have been packaged as part of the planning guidance for every district in the country, for every facility in the country. What this means is that when people plan, and specifically when they plan for TB, they'll use some of the strategies or some of the interventions that have worked in Chongwe. So basically the work of Jata has influenced the way we do business in the rest of the country.
Jata has since trained a total number of 262 treatment supporters engaged in the prevention of tuberculosis and other related diseases. Dr. Patrick Lungu is National Tuberculosis Programs Manager. Outlines how the TB treatment supporters trained by Jata are supplementing the ministry's vision of a TB-free Zambia by providing quality diagnosis.
The TB treatment supporters are very key because they live with the patients in the communities. They are key in finding the TB patients who are there in the community who have not accessed care. They are key in supporting TB patients who are on treatment in terms of supporting them, encouraging them on taking their drugs so that we can achieve cure. The burden of TB in Zambia is very high, and most of the burden of TB is not in people who are in hospitals, but in people who actually in the communities. People are living with the disease in our communities and are not seeking medical attention. And to that effect, the ripple effect of them not seeking early medical care, living with the disease in the community, is that they are transmitting the disease to their loved ones as well as our friends. And also at the time we are picking up the disease in most of these individuals, that when they come to our facilities, is that it's actually too late. And this is actually why we are recording some death attributable to TB. I want to mention that TB is a curable disease as well as preventable. If we can have people actually at community level presenting much early, we can actually find these cases and achieve cure.
What are some of the challenges faced by Lusaka district in the control of tuberculosis? Ms. Ndimuna is TB focal person for Lusaka district, and she gives us an overview.
We have a number of challenges that we face. One, it's on the stigma, patient stigma, that's self-stigma. You find that at times, mostly, because people in the community, they associate TB with HIV. Once they are told that they have TB, they wouldn't even want to continue the treatment. The other challenge is most people, when they get sick, they would first go to the traditional healers or the pastors. These people, they'll end up treating them and not curing them. So in the end, when they have failed, that's when the patients will come to the health facility. But then you find that you won't even be able to do something, the patient dies.
The current project of comprehensive TB HIV project with strengthening community participation in Chongwe district that started in 2015 and supported by the Ministry of Foreign Affairs of Japan is coming to an end in December 2018. With the current project, Jata has been supporting 48 TB treatment supporters engaged in the prevention of TB and other related diseases. Apart from supporting TB treatment supporters, Jata has been providing various trainings to health personnel. Mr. Piri and Mr. Mtonga are health practitioners from Chongwe district and highlights the role that Jata has played in the control of tuberculosis.
Around the facilities Jata was supporting, were very much aware of the TB messages because they would involve the community itself to do the TB sensitization. The other thing is, they've been providing financial support in most of the activities in the district. As you know, as government alone, we cannot afford engaging the TB treatment supporters in terms of, IGA, just to motivate them to continue to carry out those community-based activities. To give the correct messages to the community, which is which is the road. People will be able to have the correct information and will be able to make informed choices.
My role in fighting TB is to ensure that the availability of TB reagents and other laboratory commodities that supports the fight against TB. And you agree with me that without these equipments, TB might not be fought properly. But with these various equipment that are in place, more especially the gene expert that Jata has given us, it has helped us to fight the TB control very well in the district.
Precious Chewe attended the chest X-ray taking training, and she tells us more about it.
Jata has really helped me a lot. In fact, as I'm saying, I think I've improved in my skill as a radiograph technologist, because they had organized some trainings like X-ray reading and X-ray taking. When I say skills, especially that training for X-ray taking, it really helped me, because those other days I couldn't differentiate between a good X-ray and a bad X-ray in terms of quality. This is an X-ray machine which was donated by Jata. We are really grateful that we are having this, because it was a problem where patients come and then we tell them to go and do an X-ray from Levi Mwanawasa, these other far places. So now we can do it here on our own. We do an X-ray, then a clinician will review it.
The treatment supporters have acquired knowledge on tuberculosis through the Jata-sponsored trainings, and they share their experience with us.
Jata, they're doing fine. Reason being simple, Jata, they have tried to empower the TSS in different angles, and they have tried by all means to motivate the TSS. So for which, through their support, even TSS, they are happy to give their services at the facilities on TB treatments.
Vambili kutila muri bajata bati pasa ma training yambili na za vambili maningi va TB, psychosocial, HIV training na ma home gardening yalipo, so na tandisika maningi. Kaidi ngati tunaende ku training sunga zio motandizila abantu. So kwa mene taenda kuma training zi at least naziba patient nangu pochoka che kunyumba kufika kuno ani mikizako abiti nangu batatu bazi watinizwa maningi pa information maningi ya TB. So vanitandisika maningi nizwa mumuzira patient mwamene yaliri ngatanifunsa ine nimvera ma signs and symptoms sunshine namuuza mwamene afunikira kuchita na mwamene iliri ma signs and symptoms yonomvera ya TB. So endopimise ukapimisa nga TB waipeza uzamba treatment vapola.
Thelma Monsa is also a treatment supporter with a garden sponsored by Jata as a way to motivate her in order to execute her duties effectively.
Jata has been a major sponsor for us having gardens as treatment supporters. It is one way that we were taught to be to be empowered. So this is my garden. It's just a small portion but very helpful in terms of economical challenges. They provide us with seedlings, chemicals, fertilizers and other tools that we might need for us to maintain our gardens.
So how does this help in the control of TB?
In the control of TB? Well, this doesn't really help directly in the control of TB, but it helps motivate the treatment supporters so that they can work harder in their duties that they perform in order for them to combat and control the spread of tuberculosis.
Ms. Odor is a TB nurse at Chongwe District Hospital. She highlights how Jata has helped the hospital in the fight against TB.
The challenges that we faced was transportation, but since Jata came, they helped us with bicycles for the volunteers. We received a few bicycles, 5 of them, to be shared amongst the 12 volunteers. So that sort of lightened our transportation burden, because the volunteers are able to reach places as far as Katende, which is about 5 kilometers, 6-7 kilometers from here on bicycle, and then bring samples or follow up a patient.
Another TB nurse at Bowlen Clinic in Lusaka District is Gertrude Silomba, who is thankful for having received equipment from Jata to help in the elimination of tuberculosis in the city.
The selection of Bowleni was very helpful to the control of TB in Lusaka. Bowleni is a hard desert compound. Bowleni Center provides TB services to people coming from Ibex, New Kasama, Nyumbayanga, Chilenje, etc., etc. Then, in addition to what Jata did, they provided equipment, X-ray equipment. That was the machine we didn't have in the first place, and they were providing accessories to use in the same machine. They also provided lab, so this also reduced the walk distance for patients to walk long distance, because before that patients used to go to Chilenje, they used to go to UTH, but when it was brought within, it was very helpful, and it used to help patients to start treatment early, because we are able to get treatment, results on time. They were able to do the X-ray within the premises, which reduce the walk distance to the patients. Also, it helped patients, those who didn't even have money to pay, because it provided free free services to our community.
Harriet Lupia is a TB survivor and tells us how she discovered she was TB positive and how she was helped by TB treatment supporters.
Negative. Paka masiku enzo kungoenda mpaka ndipanena bwana dwala maana mbuluzi nyama nyingi appetite na kuyenda nikamba kuyenda nizikulema so ndemo mimi nabwelera ku hospital so kuna ku hospital bwani bananipi hospital na x-ray hospital mu inabwa ni soft negative inabwa pesa kama x-ray so bana ipeza chabe muamini mu x-ray ndipo ene bana nyamsana mkwala pamene penzo bora kuniona na kunista encourage kuma mkwala so mpaka baadaye mimi nasiliza sinalekezepo just from day one mpaka 6 months.
Jata Board of Director Nobukasu Ishikawa gives a vote of thanks to Jata Zambia on marking 10 years of service in Zambia.
This is the year we commemorate 10 years of our projects. On behalf of TB Association Jata, I would like to congratulate the Zambian people and people who are related to the project and who have collaborated the project, and also the people who are involved in that project, and so that we can review our achievement, and also we would like to make a kind of historical steps to strengthen the TB program in Zambia. And we feel that TB is not easy disease to be controlled, and it takes a long time, but we would like to continuously work together so that this world, including Zambia and other African countries, and also Asian countries, and also in Japan, we can end TB as soon as possible.
Tuberculosis kills over 1 million people each year, mostly in developing countries where poor public health systems hamper efforts in diagnosis and treat it. But NGOs like Jata are investing in capacity building for health workers, empowering community with knowledge on TB and other related diseases to embrace new health technology that could help fight the disease more efficiently.